بسم الله الرحمن الرحيم. هتكلم النهارده محاضرة عن reversed shoulder arthroplasty in proximal humeral fractures. Of course, proximal humeral fracture is a common injury in older population, while the majority of these fractures are treated non-operatively. A small subset of patients may benefit from surgical treatment, and there is an ongoing debate regarding the ideal surgical treatment strategy. The operative treatment options are open reduction, internal fixation, close reduction, and percutaneous pinning. Intramedullary nailing, both are not used. Hemiarthroplasty and reversed shoulder arthroplasty. This is the statistics of the last decade in United States. We can see here the reversed shoulder arthroplasty is ongoing in rise. Both total shoulder and other methods are declining, while the open reduction internal fixation is still high, but start to decline. This is in the United States. The trend, a decade of proximal humeral fractures in management in elderly, close reduction decreased by 60%, hemiarthroplasty decreased by 81.4%, intramedullary nailing decreased by 81.9%, ORIF decreased by 25% only, and total shoulder decreased by 80%, while reversed shoulder arthroplasty increased by 1,800 and plus percent. Also, there's another study from United States showing the great rise in reversed shoulder arthroplasty, declining of the hemiarthroplasty, and declining also of the open reduction internal fixation, but the ratio of all is still high. This is in the United States, but in Europe, the National German Registry during the period 2007 to 2016 reported ORIF to be the most common operative treatment method, although reversed shoulder arthroplasty has the greatest proportional increase in the utility over the period, supporting its growing popularity. The Swedish registry has the same result, as doubling the arthroplasty rate in Sweden. In Finland, also the registry over the last 23 years, long-term trend of surgical treatment of proximal humeral fractures, similar rise in ORIF, whereas there is a six-fold increase in the arthroplasty rate. Of course, in the open reduction, the advent of locking plates has made the treatment of osteoporosis in proximal humeral fracture amenable to surgical intervention, of course, improved functional result. However, maintaining an anatomical reduction and avoiding osteonecrosis, screw penetration, malunion, non-union continue to be a challenge. So, the multiple retrospective study has compared reversed shoulder arthroplasty to ORIF in the treatment of proximal humeral fractures. Reversed shoulder arthroplasty demonstrated better range of motion, especially in the forward flexion. The study showed trending more complication in the revision rates after open reduction internal fixation patients above 65. Of course, these studies excluded the fracture dislocation and head splitting fractures, which arthroplasty is the main method. Why popularize the reversed shoulder arthroplasty in the proximal humeral fractures? In November 2003, the FDA approved the use of RSA in the United States. From 2003 to 2004, shoulder arthroplasty rate is growing faster than ever. Compared to hemiarthroplasty, reversed shoulder arthroplasty provides more reproducible function with a better recovery and active forward flexion and abduction, even when the tuberosis doesn't heal or didn't heal properly. Of course, we all know that greater tuberosity non-union or both tuberosities non-union or lead to a very bad result in hemiarthroplasty. Nevertheless, tuberosity reconstruction and healing in reversed shoulder arthroplasty for fractures improves active mobility in forward elevation, external rotation, as well as patient satisfaction. Additional humeral bone graft to improving the tuberosity and healing and robust tuberosity reconstruction enhance the healing. Of course, new designs stems from fractures and with hydroxyapatite coating or any bone growth encourager, and the metaphyseal window for bone graft augmentation, as we see here. Improve the healing of the greater tuberosity, of both tuberosities, in course. The inherent stability based on the design biomechanics increase its popularity. This is a very important step. The reverted shoulder, anatomical arthroplasty is more or less unstable. But the inherent stability based on the design here enhances its popularity. Like in this case, a comminuted fracture of the proximal humerus, intraoperative even without reattachment of the tuberosity, the joint is stable now. We can move it to a good range of motion even without stabilization of the tuberosity. Also, the reverted shoulder arthroplasty characterized by rapid recovery and return to early activity of daily living even with a short rehabilitation period. This is a case of 80 plus patient with fracture dislocation of the shoulder, treated with reverted shoulder arthroplasty, and this is now swimming in less than 2 months after surgery, which is not possible with anatomical shoulder replacement or even with open reduction internal fixation. The increasing success of reversed shoulder in the treatment of proximal humeral fracture results in a paradigm shift in the management of these injuries, especially in elderly patients. As a result, there has been exponential increase in the volume of reversed shoulder in the last decade. But the debate is still going on. Thank you.